Hello and welcome to the Fall Prevention Education session by the Jewish Rehabilitation Hospital, Nursing Part 1. You are watching this video because you have experienced one or more falls, or you are at risk of falls according to an assessment performed by your nurse, occupational therapist, or physiotherapist. Each year, a third of all seniors aged 65 and over fall each year. Falls are responsible for 63% of all injuries in seniors. 10% of accidental falls will result in serious injuries like a fracture, dislocation, or brain trauma. The most common fracture from a fall in the elderly is the hip fracture. 10% of the elderly will die in the first 10 days following a hip fracture. 25% will die after 6 months. If one survives, 60% will have a decreased mobility, and 25% will have decreased autonomy and will need placement. The good news is that you can prevent falls by making your environment safer. This information session on preventing falls is comprised of 3 video sessions, one given by a nurse, one by a physio, and one by an occupational therapist. Today you are listening to the nursing part of the 3 sessions. Why should you watch all 3 sessions? Because each session discusses different topics related to preventing falls. The nursing session will touch on medication, urinary incontinence, and how blood pressure can affect and increase your risk of falls. The physio will discuss the proper footwear and walking aids and how balance and activity relates to falls, and the occupational therapist will discuss the hospital and home environment, life habits, risk-taking habits, and assisted devices that can be used to help prevent falls. In this session, we will discuss fall risk factors, sensory changes, food and nutrition, urinary problems, the circulatory system and blood pressure, the medications that you take, and the side effects that can all be related to your risk of falls. Your risk of falls increases with aging. As you age, you have less strength, less equilibrium, and your reflexes are not as quick. They can also increase because of musculoskeletal problems such as a fracture or arthritis. Due to pain, decreased strength, you're at more risk of falls. If you have visual problems, this will render you more at risk because you're not able to see the dangers in your environment. If you have a neurological condition, like a tumor for example, or vertigo, makes you dizzy and you're more at risk of falls. Being diabetic increases your risk of falls if you're prone to go hypoglycemic or low blood pressure as well. One might think that it is normal for an older adult to fall. Actually, this is false. Although aging brings changes to our function and our way of life, falling is not part of the normal aging process. Falling can cause injury or be a manifestation of another health problem. With aging, our senses may become less sharp, and this increases our risk of falls. We will discuss what you can do to prevent falls if you are experiencing any visual changes. It is important to see an optometrist every year to check if you need glasses or an adjustment of your prescription, and to check the health of your eyes for cataracts, glaucoma, macular degeneration, or dry eye. Studies have shown that cataract surgery for the first eye significantly decreased falls by 34% among people aged 65 or over. Diabetic retinopathy is an eye condition that can cause vision loss and blindness in people who have diabetes. It affects blood vessels in the retina, which is the light-sensitive layer of tissue in the back of your eye. If you have diabetes, it is important for you to get a comprehensive dilated eye exam at least once a year, called the retinal exam. Another recommendation is to allow yourself time for your vision to accommodate when you go from a very bright environment to a dark environment and vice versa. Your house should be well lit and use a night light at night. If you are experiencing changes in your hearing, the following recommendations are for you. If you are experiencing a loss of hearing, ringing in the ear, or whistling, called tinnitus, issues with dizziness, lightheadedness, nausea that could be related to positional vertigo or labyrinthitis or Meniere's disease, consult your family doctor. He will be able to refer you to an audiologist or an ENT specialist. Other recommendations are to wear a hearing aid if you need one and ensure that it is working well. Check to see if there is any buildup of earwax, and if you are prone to wax buildup in your ears, check it regularly and have it cleaned regularly. Avoid using Q-tips. It actually impacts the wax in the ear, so applying mineral oil is recommended to soften the wax. Reduce background noise as much as possible, and speak to your doctor about referring you to the Raymond Dehors Institute for more resources. Here are some recommendations for you if your sense of touch has been altered. Here is a picture that demonstrates our skin layers and where in our skin do we feel heat, pain, touch, cold, or pressure. If you have polyneuropathy from diabetes, polyneuropathy will alter your ability to feel heat, to feel pain, to feel touch and pressure at your fingertips or toes. It is important to treat any injuries or cuts right away. Consult your doctor or CLSC if necessary. Be careful when cutting your nails. It is recommended to use a podiatrist or foot care nurse, especially if you're diabetic. Pay attention if there is a loss of sensation due to diabetic neuropathy or stroke or decreased mobility. Check the temperature of the water before taking a shower or preparing your bath. Examine your feet regularly. Avoid walking barefoot or in socks. Wear shoes with non-slip soles. And pay attention in the kitchen to avoid risk.